Hello, my name is Dr. Brandi Boan, and I am one of the partners and co-founders of Optimal Vitality. Optimal Vitality is a concierge service that was designed by Dr. Gretchen BOULES and I to provide optimal care to an individual. We've created this organization to strive to provide holistic aspects of care to best treat somebody physically, emotionally, mentally, and spiritually. And we hope to do this beyond the confines of insurance and managed care, which is why it's a concierge service. Our practice is growing, and we've been very excited to bring on additional providers to help provide these services. We are excited to be able to go through the research with each other as well as outside entities and pull out what we feel are the best standards of care and the most researched and statistically proven interventions and provide those to our client base. So let me tell you a little bit about my professional background. I am a neuropsychologist by training and also a prescribing psychologist, which essentially means I'm a psychologist that can engage in psychopharmaceutical care, which is providing psychiatric medications to people. Neuropsychology and psychological assessments are a very important piece of the treatment interventions that we provide. Neuropsychological evaluations and psychological evaluations are extremely important in determining what types of care and interventions we are going to utilize with an individual. And it's also important for the individual to learn more about themselves. Neuropsychological assessments or evaluations utilize different statistically proven evaluations to examine someone's cognitive ability. That includes their intellectual ability, their academic abilities, memory, visual spatial skills, visual motor skills, executive functioning, and the different aspects of cognition each brain lobe is associated with. And what we use these interventions for, these assessments for, are to evaluate a host of biological or neurological things that could impact somebody, as well as psychological. For example, people who might have had a stroke or a brain injury or a concussion may seek a neuropsychological assessment to determine cognitive abilities after the incident. Neuropsychological assessments are also beneficial in determining if somebody meets the diagnostic criteria for an autism spectrum disorder, ADHD-related disorder, learning disorder, dyslexia, or nonverbal learning disorder. Psychological assessments are also beneficial in terms of not just assessing cognitive functioning, but in assessing personality functioning. These types of interventions are often questionnaires and are utilized to essentially determine how somebody perceives themselves, how they perceive their environment, and how they perceive the interactions between themselves and their environment, including people within their environment in the past and in the present. And it's also a good evaluation of how they view their ability to cope with stressors and what symptoms of mental health they feel they have. And we utilize the information gained from these assessments to best treat an individual, as well as determine what the course of action is based on a diagnosis, if one is applicable. And the nice thing about having a concierge service is that while diagnosis is important for knowledge, a diagnosis does not dictate the standard of care. We are able to create a standard of care based on the information that we learn from these assessments. And then that standard of care and those interventions are specific to that person. So it was wonderful meeting you guys and telling you a little bit more about myself and Optimal Vitality and my participation in that. We hope to see you soon, and if you have any questions, just give us a call, email us, just let us know. Have a wonderful day.